Warm welcome if you're just joining us now on YouTube, Facebook, LinkedIn, Twitter, wherever you may be. A warm welcome to this third weekly assembly every Monday. The Movement for Immunization Agenda 2030 meets, convenes. We have more than 6,000 people who joined. We're reaching over 43,000 people, almost 44,000. I'll give the updated numbers today. We'll be starting in 20 seconds. Count down with us, if you will. Here we go. Warm welcome to you from Geneva, Switzerland. My name is Reda Sadki from the Geneva Learning Foundation. I'm here with Charlotte Mbou, who is having technical difficulties today. Charlotte, how are you? How are you feeling?
Well, Reda, I'm a little bit frustrated, but fine.
All right, we'll make it.
And just so much excited because we are starting this.
All right, let's go then. And what are we talking about here? You can see the agenda here. The agenda is packed. I can tell you already that we will be going overtime today for those of you who are able to stay and who want additional guidance for the situation analysis exercise that we're launching today. Now, this is about the Movement for Immunization Agenda 2030. The Geneva Learning Foundation, through its full learning cycle, is aiming to contribute to this movement. Right now, today, we're reaching 43,909 people, immunization professionals, through the platform. This is not only, we say this every week, this is not only about the connections you make with us, this is about the connections you make with each other. And this is the third week, the 14th of March, actually, of the full learning cycle. We've just completed the first part of the cycle, which was about sharing ideas and experiences around these challenges. Now, we're on a road, on a journey from action, going from knowledge all the way to impact, to the day when you can report back to your peers, to your colleagues from all over the world, that you've been successful in implementing a project that is making a difference, that is reaching children previously unreached by vaccination, that is helping to protect children and their families, men, women, girls, and boys from vaccine-preventable diseases. Now, we asked you to choose to make a decision. Will you participate? Will you join the situation analysis exercise? This is what we're going to be doing for the next 4 weeks. Now, we have 6,391 people who were accepted, and 5,681 of you said, yes, I'm ready and will be doing situation analysis. That is a remarkable number of people to make this kind of commitment. Now, many of you are struggling with connectivity. Before I go any further, I just want to acknowledge Sharish from Pakistan, Shahid Iqbal, Saijad Afiz, also from Pakistan, Modupe Orols. Please tell us what city and country you're from. Sunday Audu. I'm not going to be able to acknowledge everyone, of course, but if you have poor connectivity, I highly recommend, and I'm sharing this for the members of the movement who are here in our Zoom studio, to connect with the podcast. And yes, I see lots of yeses in the chat. You understand how this works now. Anybody who needs help, and please type help if that is you. Please type help in the chat. All right, I know you are committed, but if you need help, don't suffer in silence. Tomorrow is the experience sharing session, so I'm going to share that. All right, share experience. Jan Mohammed, I see you and I see that you need help, so I encourage you to join. I'm going to share the link here, so for technical support or for experience sharing. We'll be explaining things. And we just had the session with the Francophones, and I am going to be staying overtime to work with those of you who already want to know more about the situation analysis exercise. This is a rigorous 4-week exercise, and it is starting today. So really the goal is to help you make better decisions and take better action to tackle your most important and urgent challenge. And the specific goals this week are: 1, to join peer grade, and 2nd, to actually draft your first draft of the situation analysis this week. This is not something that needs to take a long time. Put as much or as little time as you are able to put into it, but make sure you have something by the end of this week, even if it's just an outline, whatever it may be. So I'd like to ask now all right, and we already have 11 hands raised. So let me just let's try it. Before I go any further, you've already been listening for several minutes. Let's go to Yahoo Afsat. You have your hand raised, Yahoo Afsat. And let's try, Sunil Raja. And let's try to hear from all continents, just to hear how you're doing. We're going to show you what you told us in the different surveys and so on. But Sunil Raja, if you're able to speak to us, I've asked you to unmute. If not, that's okay too. We'll keep going. Mohamed Tala Tariq, Asma'u Ibrahim, Maifada, and Zakari Sani. If any of you would like to unmute and tell us how you're doing, tell us if you achieve these two goals, please do so. Let me try one more, perhaps. Okay, Zakari Sani unmuted. Please go ahead. Tell us, did you achieve these two goals?
Yeah, good evening, Mr. Rada. So for the last week, actually, I discussed with my twin, IA 2030 twin, Alata from Gambia. So we discussed on how to improve, how to reach 0 dose and get vaccinated from the vaccine preventable diseases. And I do begin to share my idea on the idea engine, but I learned that it is on every Friday. So this week I will try to improve in my participation.
Okay, thank you, Zakari, for that commitment. And did you enjoy meeting with your colleague from the Gambia? That's important.
Yes, I enjoy it. We chat on the WhatsApp platform.
All right, wonderful. And I hope many of you, I'm going to share the actual numbers, but so many of you did, in fact, have successful meetings with your twins, or rather your triplets. Now, going to explain, I explained this before we started the assembly, and that is that as of today, we have closed the doors for the situation analysis exercise. So if you have colleagues, it is too late for them to join if they have not yet joined. Joining requires them to apply to the movement. Now, applications to the movement are still open. And I'll explain to you why. It's because we're going to be working together as a group in the next 4 weeks. So it's important that everybody stays in sync. But on the 2nd of May, we'll be going to the next phase of the full learning cycle. And all of the people who've applied between now and the 2nd of May or the 1st of May will be invited to join us starting on the 2nd of May. So we'll actually be coming to you and saying, especially if in your country there is 1, 2, or 5, or just a few people from your country, we'll be coming back to you and saying, what's going on? Can you, what are your colleagues saying? And we'll be inviting them to join the movement starting on 2nd of May, but they should apply as soon as they can because we may be more selective in the future. And then there are 3 countries. If you are from Cameroon, there are 2 bilingual meetings each month. So Charlotte has put together this information with the 3 countries that have meetings on a regular basis. We'll be sharing the full slide deck, so don't worry if you don't manage to write all this down. Nigerian scholars have a monthly meeting. The next one is this Wednesday, so you can see that here. And of course, there's a Telegram channel for each country. So country of Ghana meets every Sunday. So again, the point of connecting with your country team, we haven't told you yet. We first want to make sure you are able to connect with them. And then you'll be able to learn more by joining one of these meetings. There's also meetings for the Francophones, but really, what I want to know is, how are you doing? And you know that at the end of each week on Friday, I send you a message and I ask you exactly that. And there's a button where you can just say, yes, I'm active in the movement. And you can see here, you can say, I'm doing just fine. Don't worry about me. But you can also say, I have a problem and need help. You can also say, I want to share my experience. So just want to acknowledge that. And some wonderful, wonderful testimonials from people who had problems but made it. Now, only 247 of you shared back. We asked you to report back about your twin, all right? And we know many more of you had successful experiences, but of those of you who did respond, 82% were able to connect with a scholar that you were matched with. All right, so that is an amazing result, and we know we've been seeing lots of good messages of people who really enjoyed connecting with each other. Remember that this movement is about you. It's about people. It's about humans connecting with each other to make a difference for immunization. but it's also about being human with each other. And being human means sometimes having a coffee. Even if we are separated by distance, we don't let that stop us. So those of you, there's also one person who was asked to link up with you, and that was less successful, but still. And here we're going to turn to you, so I'm going to lower all the hands, and if you'd like to share the story of something that surprised you, something that you really had a great experience with your remote coffee, then please raise your hand again. I had already shared my idea in the Ideas Engine, but my twin had not yet, so I found him on WhatsApp and left a message. He agreed to join the Ideas Engine and share an idea. He's done it today. So this is really peers, colleagues, helping each other. That's an amazing story. Congratulations. We don't put the names because, for different reasons, but congratulations on this one. It's possible to chat with someone you have never met, and they were very friendly. Someone who seems surprised. But between immunization professionals, that does not surprise me, at least having worked with so many of you in the last few years. Even though I will be alone here in Afghanistan, I have friends and colleagues somewhere in the world to speak to and discuss about immunization services. That is certainly worth applauding for those of you who work in fragile contexts, as we say. I learned a lot from my twin, especially his ways of planning activities. So real learning. So for Professor Becky Tagbo, just to clarify, this was in the actual email. It's a small link. It says, please give us your feedback by, I think it was by Sunday or Monday. I'm not sure. Now, for those of you who had challenges connecting with your twins or your triplets, give him time. And if it doesn't work, move on. There'll be other opportunities throughout the full learning cycle to link up with others and to really find your twins if you were not successful on this round. So do not despair. Now, we asked you, it's been just 2 weeks, but we're already receiving remarkable stories of what is changing for you. And I'm going to ask you how you're doing. I'll share the data first, but I see 5 hands raised. So let me go to Edem Uwa and Tina Michael. And I believe I remember Tina from Kaduna State, Nigeria. Let's go first to Edem Uwa, and then we'll go to you, Tina Michael. Edem, please introduce yourself and tell us, how are you doing? Whether it's your remote coffee, your challenge, the Ideas Engine, what are you feeling about the movement?
Yeah, thank you very much. My name still remains Edem Uwa from Nigeria, in Akwa Ibom State, working with the Ministry of Health. It's been great. It's been a good opportunity being a part of this movement. I have been able to share my idea on the challenges of supply chain management system, which of course is the basis of vaccine security in the country. The challenge has been, why are we having stockouts one moment or the other? There should be a way this should be handled. So my intention is to share with my team to say, is it possible to have a sustained vaccine security in the country? And moreover, how possible could vaccine storage system in the remote areas, the local areas, can be sustained? Because one of the reasons why we have stock out in those places is as a result of maybe poor storage system. The ice pack may not be able to last for long. And so when you get there, you discover that vaccines in one time or the other would have not been installed, reason being that the storage system would have been a challenge. So I've been able to identify with my twin, Dr. Isa Kojal from India, and we've been able to chat on the periphery. We have not really entered yet into breaking into some areas of challenges and ways it could actually be handled. So I want to believe that I have really gained a lot in the course of this movement. And I want to believe by the end of this week, I should have been well structured on how to handle some of these challenges so as to be able to attain some high level of vaccine security all around the country. Thank you. I'm over.
Thank you very much indeed. Now, we asked you 2 weeks in a row, and then we compared from 1 week to the next across 5 indicators. So this is indicators for learning, for community, not indicators for vaccination, but the principle is exactly the same. And you can see that between the week of 7th of March and the week of 14th of March, dear Adem, you see all the indicators are up. And this means when we ask you, has participation helped your professional practice? Has your participation made you see the world differently? Has it affected your social connections? Has it changed you as a professional? Has it changed your ability to influence the world as a professional? And we'll keep asking you these questions. You do not have to answer every week, all right? Want to reassure you. You can also just say no. But if you have something to report, something that's changed, then please do tell us. And I want to acknowledge and celebrate, Edem, your story, as well as you can see at the top right of the screen, Sandra Nyarko Poku, who says, I'm doing great. And that is important to hear as well. Now, let me go to Tina.
All right.
Tina, Michael, thank you. All right, she's gone. Great. All right, thank you so much. Yeah. And we have some
marvelous the way.
Thank you, Edem. Yeah. And so we have some amazing testimonials. I'm learning from others in the movement, this one person said. Ideas Engine is a winner. I'm building my confidence as a professional as a result of knowing more about IA 2030, learning from practical strategies and implementing them. The discussions have deeper insights and diverse good ideas, results oriented. There are many, many more testimonials like this. We'll share, of course, the full slide deck so you can go through them. I'm not going to read them now. I would rather listen to your voices and hear exactly how it went for you. Now, we have a number of people who also shared experience. In that same, you can see here, 53 people. Let me get myself out of the way here. I want to share my experience. So this, and I want to acknowledge here and really honor those of you who took the time to share. We've selected 1, 2, 3, 6, 7. So Gurpreet Kaur, I'm going to see if, so Gurpreet is not with us today. Nasir, all right, Nasir Tsafe, yes, is here from Nigeria. And has shared an amazing, shared experience. Paulos Samuel from Ethiopia. Let's see, Samuel, all right, is not with us. Hudu, let's see if Hudu is here. You can see about the low turnout of COVID-19 vaccination. So you can see we'll be sharing this. Let's see if Beatrice is here. She is not. Alupo, let me see if, but you will be able to see and read the experience they have shared. And for those of you who don't get to speak, this is one more way in which you can share. So Arum as well. Let me see if we can go to at least Nasir. Now that I've gone through them, Nasir Tsafe Umar, you shared. It's quite detailed. I have trouble reading it because the text is so small. But please tell us. Please introduce yourself. So you're a laboratory epidemiologist and trainee toxicologist. You work as a management support team supervisor and as disease surveillance control prevention officer at both local, state, and national levels. You're based in Zamfara, Nigeria, with the public health department. What is your most urgent challenge and why? What did you share and why? The floor is yours.
Yeah. Hello. Hi. Can you hear me?
Loud and clear.
Okay. Yeah. Thank you so much, Rita, Charlotte, and all the participants. And I'm really happy and very grateful for giving me this particular opportunity to be able to share my experience. I'm going to make it a kind of brief because of the time factor. So basically, all those from Nigeria, especially from the core north, I'm sure they are aware of the problems we've been having regarding immunizations, not just about COVID-19, but even for other immunizations as well, especially the recently eradicated polio that we have had because of the upscale in eradication of polio, whereby we had to, the country had to concentrate really on the house-to-house immunization activities repeatedly every month and things like that. So a lot of people got fed up and, and then developed so many negative thinking and ideas. And when they connected with the conspiracy theories about vaccinations, so it becomes really difficult for the immunization health workers back in the field. So the ideas I have shared actually emanated from the very time when we were dealing with polio eradication, whereby we had to gather together among all the stakeholders who are actually dealing with vaccine hesitancy non-compliances. We had to put our heads together and create a kind of subcommittee which will really go deep into all those problems and meet people not only in groups but also in individual one-to-one outreach activities, not only during implementation times but even after the implementation, sometimes even at night time, weekends, and even time that in between rounds. We have to keep doing that. And basically those are the ideas that we shared. So many issues and so many problems that we have, whereby you see elites who are professors and doctors, consultants in the hospitals and professors in the universities, and also rejecting immunizations because of the conspiracy theories. And then you have people from the religious backgrounds who have a lot of ideas. They will bring quotations from the Holy Quran, from the traditions of the Holy Prophets and what have you, to be able to show why they are actually non-compliant. So we had to put our heads together, create local solutions. And these local solutions, what we did was we tried to make sure we go point by point to get each and every factor of the non-compliance, created a line list, and then from the WHO IDSR form, which the house-to-house teams, and also even during the RIs that the people supposed to fill whenever they have non-compliances, we decided to modify it according to our local needs and our local problems. We modified the line list forms, and we created so many variables there that will help us in being able to tackle the problem and being able to trace the people themselves and then go and meet them, whether in the office or in the house or in the market and what have you. And we try to make sure we get at least few individuals from all the stakeholders to come with us. So at the same time, whenever we go, we were successful in resolving the problems by tackling the issue according to the categories. If the person is talking about what vaccination is all about, we go deep into the knowledge of vaccination. We tell him that, especially like in my own case, I have myself been in research for vaccine development when I was studying in Malaysia. So I have, I know every detail of how a vaccine is developed, and I've also done work on vaccines as well in the past.
Wonderful.
So with that, we are able to convince even the elites by giving them facts and realities. And all the conspiracy theories, we debunk all of them by giving them also facts and realities. When it comes to religious aspects, we also go and do our research. We get our traditions from we get our quotations from the Quran and traditions from the Holy Prophet. And by so doing, we're able to get people to understand, and then they actually comply with the issues. So by so doing, a lot of our other colleagues kept surprising. Why are we successful? Because there are people who have 7 years non-compliance, 6 years, 5 years non-compliant, but we were able to resolve them. So this is why we kept telling them, no, it is doable. So what I believe is, from the national to the state and to the local level, there is a need to actually create a particular, to keep an attention and create a particular unit or a particular group as such that we did, in such a way that every time when it comes to immunization, we have some special groups, not only from like UNICEF, who is responsible for social mobilization, but from all other stakeholders, including the locals, who will be able to just do that.
Thank you very much indeed. I can hear the passion and commitment in your voice, and I'm sure that I trust that your colleagues from all over the world can hear that as well. Go and look at Nasir's and all the other amazing ideas and practices. But Nasir, let me ask you a question. Have you been able to join these sessions with François Gass and Charlotte Mbou to share your experience and help others with that experience? Because you describe how you've been successful challenging hesitancy. Have you been able to join these sessions?
Well, I believe I have joined the session, but I have not been able to. Last week, I was able to communicate with one of my twin. But this week, I have not been able to do that. But session, yes, I have joined, and I'm willing to to participate in the next one.
Okay, sounds like we need you. Sounds like your experience could help others make a difference, just as you have. I've just dropped in the chat the experience session registration link, and the next one is tomorrow. Now we have many actually. So thank you, Nasir. Just one example, and received over 1,000 feedbacks, including stories like this one. Just want to go to, I haven't been to social media yet, so let's see. We have many. All right, Amel Elta here from Saudi Arabia. Sunday Audu, please tell us, where are you listening from? Hassana Waziri from Nigeria. Emanuelo Chinonye Odunze. Miafo's voice from Cameroon. All right, thanks for clarifying. Tell us where in Cameroon, if you're comfortable doing so. Magaji Ubaleado Minjibir, I believe, from Nigeria. Jaurès Churchill from Madagascar. All right, thanks, Magaji, for telling us you're from Kano State. Dr. Akhtar Mohammed from Afghanistan. Let's see. We've got, all right, and here's a comment from Amel. A loyal and distinguished scholar and now member of this movement. The good thing about this platform is connecting us with our country team colleagues who we don't even meet or know, but TGLF is making us a big team. I would say, Amel, you are making yourselves a big team, but that is certainly worth applauding. Eddie Gidding Sr., who says, great, been in here today for another experience. And this is Ali Akbar from Pakistan. Just a few of the voices via social media and many more messages here in our Zoom studio. Unfortunately, we're not able to show you. Now, I want to get down to business, because feeling good about being together and connecting with others is one thing. But I'd like to talk about really the practical, hands-on problem solving and sharing of experience that's been going on twice a week with François Gass and Charlotte Mbou, and to give you examples of what has come out of these sessions so you can determine if this is something you want to be a part of. So here, for example, Samia Elmi, who's a C4D consultant in Somalia, had the challenge of low uptake of COVID vaccination. Jean Ciceron Mbunda from the DRC, and we translate these from French to English so you can benefit from the learning of your colleagues who are Francophone, who may be in a country adjacent to yours. Now, Kakisu Ibrahim, let's see if Kakisu is here. All right, good. So let's see who else is in the room. We may come to you, Kakisu, so you can tell us about your challenge of low, again, uptake of the second dose of COVID-19 vaccination. Amsalu from Ethiopia. You are also in the room and you participated in the experience sharing. So let's go to Amsalu, and then we'll go to Kakisu Ibrahim. I'm conscious of the time. I haven't yet introduced either of the two things that I said were actually the key today. One is we're going to honor all of the scholars, all of the members of the movement who have made a contribution to the Ideas Engine. And I'm going to give you the instructions. I'm going to help you kick off your situation analysis, which is the 4-week peer learning exercise. But let's go to Amsalu Shifira. Amsalu, I'm asking you to unmute. I hope you're able to talk to us. And your challenge was how to ensure sustainability and accountability from actors in primary healthcare after support was suspended by partners. And these are, you're talking about your work with communities affected by this in hard to reach areas. And I'd like to ask you not to tell us your whole challenge or to share your experience again, but to tell us you participated in this experience sharing session. What did you get out of it? Did it help you in any way? All right, Amsalu, I can see your microphone is unmuted, but I'm not hearing you, so I know.
Can you hear me now?
Yes, now. Yes, loud and clear.
Okay, great. Can you repeat your question, please?
Yes, so my question is, you participated in the experience sharing. We're sharing key takeaways with everyone, but what did you get from this? You attended the session with François Gass and Charlotte Mbou. What did you get out of it?
Yeah, I think it was a great experience. I got that I presented the sustainability challenges after we conducted some sort of project with technical and financial support and logistics support.
Yep.
Then when we move or when that type of project ended, there is oftentimes challenges in maintaining the gains that were found through the support. So the experience I got from participants and from facilitators was that initially, I think we need to plan sustainability strategies as well. And we need to also advocate with the local government. And then at least we have to allocate some amount of budget after the project is ended to support the local health workers to be motivated and incentives. And meanwhile, we need to advocate at the government at all level to allocate the budget and then to provide supporters for local governments and health workers. So planning for sustainability is critical, I think, at the end of the, when the project is started. Thank you. Over to you, Rada.
Thanks, Absalou. And so there were also, of course, there's François Gass and Charlotte Mbou who asked you questions and gave you feedback. Was there anything from your colleagues that you heard in the experience session that was potentially helpful to you? And it's okay if there wasn't, but we hope that at least for some participants there will be.
Yeah, I think the issue of experience is, the sustainability is the challenge across
for everyone
across the globe. I can say.
Yep.
Yes, but there might be some issues, innovative issues, to sustain. But I think what we need to do in the future, we should not go also right away. After the completion of the project, at least we need to allocate some amount of budget or technical assistance to visit at least irregularly or sometime, and then encourage the local government and health workers to maintain the gains that they are provided. And I think the attitude of the health workers and the local health managers are critical also, because the incentives for them should be not the money that is coming from the project, but the gains that they serve their community should be the key issue, and they need to maintain with. So I think dialogue and discussion with community as well as the health workers is critical. And for sustainability, engaging the community is also critical, so that they can demand the service, and then they can also discuss with health workers to maintain the services. Over.
Understood. Absalou Chifero, thank you. I just want to turn quickly to François Gass. François Gass facilitated the session with Charlotte Mbou. François, for you, what was interesting or surprising about Absalou Chifero's sustainability challenge?
Yes, thank you, and hello to everyone. Thank you for Absalou for sharing that, because I think it's a very important challenge for many countries, and many are facing in a local area or even nationwide, the drop of a donor at the end of the project, and nobody knows what to do in the next, and they move to another project. I think you have an issue very important, and I think what's great as an experience is that you share a kind of twin approach, which means that try to maintain the interest of the community workers with some incentive to continue what they do, and the communities to continue the demand. What's most important in your message, I think, in the idea you have put in, is to be sure that from the beginning of the project, you address sustainability issue. You're not waiting for the end of the project, say, what do we do now? Because then it will take time to recover. So I think this kind of idea that you have shared, starting from the beginning of the project to say how we're going to handle sustainability, I think is really critical. And you have addressed it at all levels, the decision maker, the one who allocate money, and the workers and the community. So I think it's a very great thing. And now innovative idea how you make the policymakers available in, interested in maintaining and contributing is also a big challenge very often for many. And for the workers, having all the elements to do their work, you mentioned an incentive, but maybe sometimes it's logistic support, is great as well. So, but those issues have to be on table as early as possible. Thank you for sharing your experience.
Thank you very much, Dr. François Gass. Together with Charlotte, facilitate these sessions. I've shared the link. The next one is tomorrow. I do want to note, Amsalou, you made a significant contribution in 2020 to the Ideas Engine, but I see that you have not yet submitted an idea or a practice in 2022. So I hope that you will be able to do so soon. Now, one of the things I would like to say is the following. Many of you have sent messages, so maybe I'm not sure how well you can see these. So this person says, my apologies, we're in the field doing polio vaccination. Since we have a positive case of polio, this will continue for 4 months. This is Lazarus. This is Elizabeth Ninson saying, sorry, I may not be able to share my experience. I will be very busy with polio campaign. My apologies. And then Dr. Dominique Amici, who says, a torrential rain has just fallen, preventing me from joining the session with other colleagues. So you'll see my message here. We always appreciate it when you take the time to write us. And we do read everything. I apologize if we're not able to respond to every single email. We receive literally hundreds of emails, in some cases several hundred emails in a day. But we do read all of them. The one thing I would like to ask you is you do not have to apologize when you are doing the work of immunization, the work of vaccination. That is when you are on the job doing your work, you are doing the movement for Immunization Agenda 2030. Sessions like this one are there to connect you, to help you solve the problems you face in the work. But please, this is something to be applauded. So I'd like to ask you to offer a round of applause for Lazarus, Elizabeth, Dominique, and everyone else, every other member of the movement who is not here because they are doing the work of the movement, the work of immunization. So please, if you'd like to, you do not need to apologize. We appreciate if you take the time to tell us what happened to you, as you can see here. And we honor colleagues like Lazarus, Elizabeth, and Dominique. And I also want to share the messages from Hassana Waziri, and Danjuma has not been successful, but here we go. So that is one message. The other message is here. We have Felicia who says, thank you for the reminders. I keep getting too many things that I get confused about. So I really don't know which one I'm supposed to do or join. So I have a very simple answer to that. And you have to understand, why do we send you so many emails? So let me be very blunt. Some people, not everyone, probably not you, but some people will, in order to get them to open one email, have to receive 10. That is a basic reason. So that's people who just are not used to processing, managing information, and it's okay. And of course, if you're diligent like Felicia and you try to make sense of it, there's so much going on, so much information we send you, you'll be overwhelmed. Don't try to read everything. The two essential things. One is the dashboard. Make sure that you've gotten to this point. This is the dashboard where everything happens, everything you need, slide decks, videos, tutorials, resources, everything is in your dashboard. And then the second thing to do that you absolutely need to do is actually this assembly today. If you're here today, and I can see this is just amazing. There are 470 people in the room right now, and some people have been going in and out. So we know there's actually significantly more than that. That's just amazing. You're where you need to be. In this session, we recap. We try to really give you everything you need to know for the rest of the week. And then the rest of the week, if you need help, every day there is a session. It's either experience sharing or tutorials. And so we send you reminders, because if we don't, you say, sorry, I forgot. Okay. So that's why we send you so many emails. I hope that helps you understand. And it can be frustrating if you're diligent, you're organized. You just need to know what happens when, and you'll be on top of it. But that's actually less than 5% of the members of the movement. So if we did not do these constant reminders, only 5% of the people would actually present themselves because they're well organized enough to not need that support. And I'd also like to highlight Lulu Bravo, who says, I was present till the end, almost an hour, and learned a lot. And she is a professor emeritus of pediatric infectious and tropical diseases at the University of the Philippines. So the other point I'd like to make, obviously, is there is a lot of information, but remember, it is there to help you with your work. I see we're already at the 39th minute, so we're going to run out of time, and I am going to go over time to present the situation analysis, but what we want to do first is honor the people who submitted 764 ideas and this is people from 62 countries. And this morning, every scholar who shared an idea or practice in the Ideas Engine received an official certification letter in honor of their contribution. So this is what the letter looks like. It's one more email we've sent you, but if you contributed to the Ideas Engine, please, contribute to the, please go look for that letter. It is an official letter. We'll have certificates that are on PDF. That will be for people who complete the situation analysis exercise. Now, you can keep sharing and finding and using the Ideas Engine. The goal was not certification. We offer this letter to recognize the effort. Some of you for the first time figured out how to log in, how to make it, how to submit an idea and shared your experience for the very first time, that is. And even if it's the 10th time, it's especially commendable. So all you need to do is go to the Ideas Engine, add an idea. But now what we want to do today is honor really the 671 scholars who've shared at least one idea or practice. And this is as of the 21st of March. You can keep submitting your ideas, but here they are. To get myself out of the way, you can see the ideas and practices by country. We're actually going to go through. I wish Charlotte could join me, but I'm going to have to do this on my own. From Afghanistan, 6 ideas. From Argentina, 1 idea from Maria Fernanda Manzan. From Bangladesh, 3 ideas shared, 3 ideas and practices. From the country of Benin, 11 ideas. From Bhutan, 1 idea from Mimi Mainak. From Botswana, 2 ideas contributed to the Ideas Engine, shared with practitioners from all over the world. From Burkina Faso, 24 ideas. From Burundi, 4. Cambodia, 1. Cameroon, 49 ideas. It's just remarkable to see countries from all over the world, immunization professionals from all over the world sharing these ideas. 6 from Central African Republic, 24 from Chad. If you remember, we did this last week. The numbers for pretty much every country have gone up. From Chile, from the Comoro Islands, from the Congo, from the DRC, 107 ideas. You can see it takes 2 slides to recognize their contributions. From Timor-Leste, 4 ideas. From Ethiopia, 9 ideas contributed. From Gabon, 3 ideas contributed and shared. From the Gambia, 4 ideas, 4 practices. From Georgia, 2 ideas. From Ghana, 56 ideas and practices shared from Ghana. From Guinea, 30 ideas and practices have been shared. From Haiti, 4 ideas have been shared. From India, 27, Indonesia, 2 ideas. From Iraq, 3 ideas and practices have been shared. These are ideas and practices being shared by immunization professionals from all over the world. Country of Ivory Coast, you can see some countries are small geographically, but huge when it comes to sharing their ideas and practices with other immunization practitioners. 1 idea from Jamaica, 25 ideas from Kenya, 1 from Lesotho, 5 from Liberia, 17 from Madagascar, 1 from the Maldives, 18 from Mali, 5 from Morocco, 9 from Myanmar, 1 from Nepal, 13 from Niger, and now get ready because I know there are many of you who are here in the room. 148 ideas and practices shared by scholars, members of the Movement for Immunization Agenda 2030 from Nigeria. 27 from Pakistan, 1 from PNG from Papua New Guinea, 1 from Paraguay, 1 from the Philippines, 1 from Rwanda, 1 from Saudi Arabia, 8 from Senegal, 1 from Sierra Leone, 1 from the Solomon Islands, 6 from Somalia, 2 from South Africa, 7 from South Sudan, 2 from Sudan, 1 from Switzerland, 3 from Tanzania, 1 from Thailand, 14 from Togo, 1 from Tunisia. These are ideas and practices shared between immunization practitioners. 7 from Uganda, 2 from the UAE, from the United Arab Emirates, 2 from Zimbabwe. And that's it for this 2 weeks. In just 2 weeks, 671 contributors, over 700 ideas collected. Now, this is the number. It tells you about the volume, doesn't tell you about the quality. This is where I'd like to turn now to François Gass. François, there are too many ideas probably for any one practitioner to look at, but you can search by keyword, you can search by strategic priority of IA 2030. What for you is important? How would you, looking at these ideas, determine which ideas are valuable, which ideas are of quality? What matters once we have the numbers?
Thank you, Reda. I think it's very important. First, when you have the number, is you have a classification, categorization of idea by the IA 2030 priorities. When you see an area that corresponds to your challenge, you type your words, the challenge you have, and you will find an idea when you open the idea door in a way, and you can explain it better than me. What's important is when an idea is expressed, it goes into the specifics of each chapter to understand the idea and to understand what are the action steps needed in order to implement the idea and to succeed in overcoming your challenge. Now, you may be missing some information that you would love to have. So there is always a chat box where you can discuss with the owner of the idea, who has put it on the idea engine, and discuss elements which are not very clear, not specific enough for you. And then you can even dialogue with the person and see if it works to your context or not. If there is no idea for a challenge, you try another idea that's good because that one does not correspond to your specific context. And we hope that you will find some food for thought in trying to resolve your problem, your challenge with those ideas. Thank you, Reda. Over to you.
Thank you very much indeed, François. And so, for example, if many of you are facing the challenge of vaccine hesitancy, so if I type the word hesitancy by keyword, here I have all of a sudden 117 ideas and practices which have been shared of contributors, members of the movement who've shared an idea, a practice, something that they do. And when you go in, so if you go in and look at Professor Becky Tagbo, who has an idea or practice we're going to see. So I click on the idea and let's see, it's an existing practice and it is describing how in an area of Enugu, Nigeria, hesitancy is high and obviously telling you about what the practice has been. So, and you can see here also, as François just said, that there is a dialogue then, discussion of the practice that Professor Tagbo has shared, and you can see it here. And there, this GCM says, this is a great idea. I have a private business and have not kicked off. I will start working on it, learning from you. Fanny says, thank you for the noble idea worth sharing. And it just keeps, you can see there's quite a bit of dialogue that starts with someone sharing that idea or practice. So that's where we are at in 2 weeks. Again, just to remind you, if you were not able to share an idea in the first 2 weeks, all is not lost, far from it. I'd like to now lower all the hands because as we go, so I have not yet introduced a situation analysis. I will do this. We will be going over time. I will be extending this session. Of course, if you need to go, if you need to leave at the top of the hour, please do so. That is, the official session is 1 hour long, but I will be sharing for those of you who want to really get started with situation analysis. There's instructions and 2 key tools that I'll be introducing in a few minutes. Now I'd like to ask you to answer these 2 questions. How did you use the ideas engine? And what's the situation and what is the challenge that you will analyze in the situation analysis? So I see Nicholas Kashama, but I know I tried to unmute him earlier and it did not work. So is there anyone else who'd like to answer these 2 questions? How you have used the ideas engine, whether it was submitting your idea or sharing what you found that you were able to use. Let's go to Imran Khan. Imran Khan, and then, yes, Imran, please go ahead. We have not heard any voice. Yes, Nicholas? All right, let's go to Imran Khan. The floor is yours.
Are you hearing me, sir?
Yes, loud and clear. Please introduce yourself, and then you have 2 questions.
Thank you so much, sir. My name is... Thank you so much. Sir, my name is Dr. Imran Khan. I'm from Pakistan. Sir, the experience I learned from Idea Engine is a very good opportunity for me that I share my idea in my practice, what I learned from my field work, I share with my colleagues. Next thing is very important that the people who give out your ideas, what you share with your colleagues. I share my idea with 2 persons, but during sharing with other people, I face one problem that my idea sharing was not sent to the other people what I want to be shared with. So in coming week, my plan is to join the technical analysis session because I'm facing some problem in idea sharing, and also another thing is in trends. So thank you so much, sir, for the opportunity. I think a lot of people learn from it, and this is a great opportunity that we have to learn and share our ideas with other people. So I think there is nothing challenge here, because all over the world, the people help each other and they become twin partners in Immunization Agenda, and they analyze what they share with other people. So thank you so much, sir.
Thank you very much indeed, Imran Khan from Pakistan. Let's go to Mike and Suka. Mike and Suka, the floor is yours. I want to help you get started with situation analysis. So please, if you can keep it short and to the point, that would be much appreciated. Mike, please introduce yourself, and then you should be able to see the 2 questions up on your screen. So.
Yes, thank you, Dr. Roda, for it. I don't know, is it okay, my voice?
Yes, please. Yes, loud and clear.
Yes, okay. Yes, thank you for having given me this opportunity to attend Immunization Agenda 2030. I've learned a lot here, and I said immunization is the way or the fact of finding solution to problems. Have you seen? Because when we give vaccine, it means for eradicating the sickness, and I appreciate. And this changed also my way of seeing this world, analyzing things, finding solution to problems. Working together. Gathering as a global community. And I understood also that no one has the monopoly of knowledge. We have to put our hands together. Let me give one example about left hand and the right hand. Okay, they keep on working together. Have you seen? They collaborate together, and the left hand can touch, and the right hand cuts. If you see this collaboration, okay, between left hand and right hand, the left hand touch, the right hand cuts. This is the collaboration that we have to keep on doing, working together. And as I've met also with tax people refusing, saying that immunization is bad, it's for killing people. And I had also another idea of convincing them telling them that you are in a side, okay, you are not right. This is the way of finding solution. I've given the example of Ebola, polio in Congo, okay. Ebola has been eradicated in Congo thanks to the vaccine immunization. And also have an idea of going, spreading the information, going from house to house, speaking from mouth to ear, so as to reach so many people joining this immunization. It's really happy. It makes me happy. And I feel myself as a professional, okay, an international professional, because working, having been chosen in this, foundation,
Yep.
Geneva Learning Foundation. It's not given to anyone, okay, Mr. Dr. Voda. I cannot keep, I have to be short, as you told me. I have so many things to say, but I can stop by here.
Thank you, Mike.
And
Thank you so much. I've been sharing your idea on screen, and I think we have Berhanu Bekele and others who asked you to give more detail about exactly what you did and how you did it. That's really what this is all about. But thank you for your commitment. Thank you for having gone through the steps to submit an idea and practice, and I hope this is a useful process to you. We have to move on because we only have 6 minutes for those of you who have to leave at the end of the session, which is what we try to be respectful of the time we ask you. In this case today, exceptionally, in response to many questions we've received about situation analysis, I am going to stay extra time to really show you, really get hands-on with what situation analysis means. And the first thing is, on the right-hand side, you should have received this email. So look for it. It is titled Response Needed Today. It was sent on Friday afternoon. It's got a little rocket ship in the subject. It's the first time we've sent this. And it's personal and confidential. It's dated 18th of March. It's got two options. And it's really a decision that each of you has to make. We're starting the situation analysis exercise today. So you'll find the resources in your learning dashboard and a lot more information tomorrow and in the coming days. The goal is to help you analyze the situation for the most difficult and important challenge that you face in your work. This is the thinking before action that should really help you. Now you can opt out. You can see there's a red button here. No, I am not interested. So please, if you don't feel ready to make this commitment, we don't want to keep sending you emails when you actually are not interested. So please tell us, I'm not interested. That way we know you're out, okay? And that does not mean out of the movement. You remain a full-fledged member of the movement for Immunization Agenda 2030. That is something that we cannot and will not take away from you. But the decision to join a 4-week peer learning exercise, and you can see here in the schedule that we shared originally, let me get myself out of the way. We just finished 2 weeks of the Ideas Engine. Now we have situation analysis that will take us through the 15th of April. So I think you know how this works. I'm now going to ask you if you are ready to make this commitment to type yes into the chat window. So, and we'll see. And of course, if you are opting out, if you're sitting this one out, that is fine as well. Go ahead and type type no, sorry, if you're opting out. Yes, all right. I wish I could show this to share this via the live stream, but it's a flood of yeses. So of course, we're going to give ourselves a round of applause, but this is not so much about the song and dance or the applause as it is about the specifics of the exercise. And Mohammed Jimo, we can show from YouTube, for example, is answering yes. Thank you, Mohammed, for this commitment, as well as to the literally hundreds of you in the room who are making this commitment. Hassana Waziri, Priyanka Mehta. So folks who have chosen to watch from Facebook or YouTube, and you can do that for the Monday Assembly. The other sessions throughout the week will be only in Zoom. Now, you see the situation analysis here has a very specific timeline, and the work begins today. So just to be very clear, this is not like the Ideas Engine where anytime over the 2 weeks you can put in something. This is far more specific and structured. So really, this week, we'd like you to complete the first draft of your situation analysis. And I'm going to explain in the extra time. I'm going to be staying more time than scheduled. And of course, if you need to go, you're free to go. You can watch the recording afterwards. But I do want those of you who are ready to start, and many of you, we just saw hundreds of yeses. And Mitong Daniel, I especially appreciate you saying yes I'm saying yes for my two twins. They're in the field and the network is too poor. Thank you for that. And that is exactly what we were hoping would happen with the twins or triplets, really, that you would support, that this would help you support each other. So you can see the deadlines here. Make a note of them. Take a screenshot if you can. Put them in your calendar. We'll be sharing them in the calendar as well. So now we get to what is this situation analysis exactly. So first of all, you can see there are 5 steps, right? And the deadline is the 1st of April. So if you're taking notes on these sessions, this is a good time to write those 2 pieces of information down. Your situation analysis, this is a document that you're going to develop in Word, in which you're going to do the 5 things that you see up on your screen. So 1, describe your challenge and your situation. You've already described your challenge, we asked you, so this is something you've done already, but your situation is what we want to dig into. And in order to understand your situation, so to really get to analyze it, want to do 2 things: highlight what you know and what you do not know. It's really those 2 things. And the what you do not know may turn out to be more important, or at least as important as what you do know. Third, we'd like you to question what you know and what you do not know about your situation. What are the assumptions that you're making? What do you take as a given? And does it actually withhold this scrutiny? What conclusions can you draw, and what actions can you take? So that's what we're going to do. And I'm going to introduce the 2 key tools, the 2 key documents, what we call the rubric, which is a PDF, and then the template, which is where you will actually write your situation analysis. But before we do, all right, I see, I want to first ask you to practice really your challenge and your situation. So there's really only 2 questions at this point. Explain your situation in relation to your challenge, and what assumptions are you making? So I'm going to lower all the hands and again ask for volunteers so we can get, and again, if you have never spoken before, please, use this opportunity. We'd love to hear your voice. It doesn't mean if you've spoken before, you do not get or should not speak. But let's start with Sani Jafar. Sani Jafar, please go ahead. We have 2 questions before you, and this is really what you'll be starting in situation analysis. So please remind us who you are and where you work.
Okay, good day, everyone. I am Jafar Sani from Kaduna, Nigeria. I'm working with Ahmad Bello University Teaching Hospital, School of Health Information Management, ABU Zaria. So permit me to thank you, Dr. Reda, for keeping us on track, for not submitting the idea engine work. Actually, you encourage us more. Before we have been apologizing for not sending, and you have encouraged us, and I really appreciate that. And God willing, we are going to try our best this week to see that we have completed everything. Thank you very much.
Thank you, Sani Jafar, for your commitment. There is no fault if you did not manage to submit an idea or practice yet. You are still a member of the movement. You are still doing the work of immunization every day. And this is what we appreciate and we honor every Monday in the assembly. But we hope also that the specific activities and the situation analysis in particular, that you will make the commitment and you'll be able to follow through.
Exactly.
So now you see 2 questions. Can you explain your situation in relation to your challenge? What do you know and what do you not know?
Okay, actually, my challenge that I want to work on this round of the movement is the way academicians in various higher institutions in Nigeria, most preferably in Kaduna, their attitude toward COVID-19 vaccine and other immunization activities. Academicians are always working with students which are younger ones, and at least there is need of something from them. There is a commitment from them. that would make this to eradicate vaccine hesitancy right from the institutions. So that is the situation that I want to work on, and that is the challenge, how to see that maybe we encourage those academicians and tell them that this vaccine, it is a thing that it is under most of us in the society. And is that from school, we gather different kind of minds, right, from the student and from the academicians, and they are going back to their community. Some of them are equally, they are the one that opportune out of many from the community to attend that academic institutions. And that is where maybe we encourage them, we tell them more about this. Now, the commitment of academicians toward encouraging young graduates in the schools to see that we move this immunization agenda into reality. That is the challenge and the situation I want to work on for this movement of immunization.
Okay, thank you, Sani Jafar. So let me show you how situation analysis is going to work. I said there were two key tools. And so the first key tool is what I'm showing on screen now. So you can see here, this is a Word document, and it's the situation analysis template. So the first thing you'll want to do is to give it a good title that describes what are you analyzing, what is your situation analysis about. So when you say, let me actually, let me see if Sani, we can get him back. Yeah, sorry, I think I accidentally, all right, let me unmute you. So if you were to give a title, so you're going to analyze your situation, how would you summarize in one sentence what you found in your situation analysis?
Okay. I can say the commitment of academicians toward immunization activities.
Yeah. Okay, yeah. All right. And then your country of focus, here you would put Nigeria, your location, your role, function, title, your challenge, and then the key area of focus. So this is from IA 2030. So if you're not familiar with key areas of focus, obviously you can click here and download the list. And now, when you analyze a situation, we're going to ask you to write out one question that you want to answer through your situation analysis. So this is something preferably that you don't know yet. What is one question that you would want to answer that would affect the decisions you make and then the actions you'd carry out to address your challenge? So Sani, let me give you some examples.
Hello? Say what?
So let me give you some examples. So this is, let me go to preview. Yeah, here. So for example, if your challenge is COVID-19 vaccine uptake is low among healthcare professionals where I work, even though the vaccine is available. So then the questions you may need to answer, let me go here, would be, why is COVID-19 vaccine uptake so low among healthcare professionals in my district or health facility? Or if you're working at the national or subnational level, you could ask, which districts or facilities have the highest number of healthcare professionals who have not been vaccinated against COVID-19? And so if you're able to answer this question by analyzing the situation, that will help you figure out what exactly is going on in your district or facility. So understanding why healthcare professionals are not getting vaccinated. And you'd need to do that if you're going to take actions to help healthcare professionals understand the benefit, the value, the safety, the efficacy of COVID-19 vaccination. Similarly, if you are able to, in your situation analysis, answer this question, which districts or facilities have the highest number of healthcare professionals who have not been vaccinated? So if you find that almost 80% of the unvaccinated are in this area, in a specific area, then you can say what's going on in this area, and you can start getting at the root cause of which will then help you determine what actions you to take. If most of the unvaccinated, the vaccine hesitancy amongst health professionals is in a specific area, then you can start to get at the root cause, which may be, well, maybe there's a specific religious community, or maybe misinformation has spread in a particular way. So that is what you'll try to find out by analyzing your situation, because obviously it's going to make a big difference how you answer, what the answer to these questions are. And we ask you, so you can look at many questions, but for the sake of time, over this exercise, given the timeline, you probably want to finish, you only want to pick one question. Another example, if your situation is that there are many zero-dose children who've not yet received their first dose of DTP1, according to WHO estimates or based on the annual report of your EPI team. So then your situation analysis in your area might be, why have so many zero-dose children not receive their first dose of DTP in your facility or in your district or in your region or in your country? And so your situation analysis would then try to answer that question. Or another question could be, where are the zero-dose children in your district community? Who are they? And then your situation analysis is going to look at, what do you know to be able to answer that question? What do you not know? And you write that up in the template. So Sunny, is that helpful? Can I ask you the question again? What is the question that you would answer or try to answer in your situation analysis?
Okay, actually, this piece of information is really helpful, and I understood fully your question now. Then my question will be, the first question is, what are the attitude of academicians immunization activities?
Yep.
Then my answer to this question will now be my situation analysis.
Yep. That's correct. Yes. And so let me take you through then that would be one question. There are other questions you could ask. There is no right or wrong answer, but the point is you want to find a relevant question to ask. And so let me skip over part one, because once you've finished your situation analysis, only then can you complete part one. You can see it says write the section after you've completed all the other sections. And once you finish your situation analysis, this is the real world. We're asking you to work on things that that matter to you, on your challenge. We're asking you to do this for your work. It's not for our benefit. This is not a course we're offering where we want to teach you situation analysis. We're challenging you to do this so you can do better in the future, using your situation analysis for your own needs. And so what we'll ask you to do at the end is to write a short note, just like an email that you would write to your boss or to your colleague saying, I've done the situation analysis, here's what I found. And really get their attention and tell them why action is needed. What have you found that's interesting? But before you do any of that, you have to go through this. So describe your situation. Explain what's specific about your local situation. So sometimes we see people who will cut and paste, and they will say generalities, very generic statements. There's a problem with vaccine hesitancy in my district. Okay, well, how does that help us? That's not analysis. That's just stating an observation. So you want to go beyond that. What is your challenge? Why is it important where you work? That's what we want you to get at. And then, why and how would answering your question help you tackle your challenge? So that's what you need to put in here. And then we're talking about immunization. So we're talking about public health. We're talking about science. That means we're talking about data. So if you're going to answer a question with your situation analysis, what are your sources? What data are you using? Preferably more than one source of data. And we want you to review, describe each data source. Now, this can be 2 sentences. We're not asking you to produce a thesis or, neither a master's thesis nor a doctoral thesis. We're asking you to produce a document that you can use. All right, this is for you. This is something for you, your colleagues, that you can show to your boss, that you can actually put to use in the coming weeks, because after we do this, we'll do the action planning, and after the action planning, we'll work together on implementing the action plan. So there's a sequence in the full learning cycle that you need to keep in mind. Now, part 4 is really the most important. Parts 2 and 3 is the setup, right? You describe the situation, you say, well, here's what I looked at. here's what I reviewed or researched, and now here's what I found. So what is the most likely answer to your question based on the data? That's what we want to know. So write this down, and then the challenge really is to defend your findings. So if you say, well, academicians have negative attitudes about vaccination, they don't think it's useful. That's your finding. There's two questions there. This is, I'm sure, Sani Jafar, you would be much more detailed and specific than that. How do you defend it? Defend this finding. Show us that this is the root cause of the problem. And second, identify any limitations. If you said, well, I only had 2 weeks, so I would have wanted to do 3 months of research, but I only had 2 weeks, so this is what I found. Okay, and that's fair enough. The idea is you do something that is good enough that you can then use for your own needs, because this is a challenge that you have selected. This is not a course in which we say we're going to teach you about the attitudes of academicians. No, this is your challenge we're talking about. And then the next steps, really, given what you know, this is about action. This is not an academic exercise. We're not, some of you may be university researchers, but in this context, we're focused on action. This, ultimately, we want this to help you take action and take the right kind of action. So yes, to answer Gray Hiera and others, we're sharing this in the learning dashboard. Remember your learning dashboard where you found out about the ideas engine? So everything is always put first and foremost in the learning dashboard. That is where you'll get this word template. And that is where this is only the first tool. The second tool is what we call the rubric. And that is where you will get the guidance to help you with the situation analysis. So what specific actionable next steps will you take with regards to your challenge? And it is about the next steps that we're going to ask you to do one very specific thing, and here it is. It is, remember the ideas engine. Everything that we do in the full learning cycle is connected. So when you think about next steps, if you're tackling your toughest, most difficult challenge, chances are that you can use innovation. You've tried some things. The things you usually do, they don't work, or else it would not be your most difficult and the hardest challenge. So here, with the next steps, you can go to the ideas engine and find inspiration. Find someone who's facing a similar challenge, and you say, well, this challenge actually helped me. And we'll show you how to get the ID number, the name of the author, so you can give credit where credit is due and show that the ideas engine is not just some nice thing that you did to get a certificate or because we asked you to or because that's part of being in the movement, but it is something that when you think about what actions you could take, what your next steps might be now that you've completed situation analysis, you can actually refer back to the ideas engine, and that is where you can recognize where you got an idea to do something a little bit differently from the way you usually do it. So that is what we want you to do in the references. So there are 6 sections in all. And again, as I said, once you've done that, to make this a real world exercise, is that and yes, for Professor Becky Tagbo and others who need to leave, I said we would be extending over time. So fully understand, you'll be able to catch the recording. I'm actually recording separate tutorials to walk through the same thing, but I wanted to do it live with you. And I am actually going to stop talking now just to complete on part 1. You write a cover note, so like a cover email presenting your situation analysis. And there you want to keep it short. You know your boss doesn't have very much time. You're writing to him or her and saying, this is what I found. This is why it matters. This is why we should take action. And then you can have as an attachment your full situation analysis. So you'll do that. You'll write this section last. So now I want to open up for questions with... and I see a first question from Beauty who says, should my idea have to be related to the topic of my situation analysis? No. So remember when you completed the very long application to join the movement, we asked you, what's your most difficult challenge, an important challenge? So probably when you pick your challenge that you want to develop the situation analysis, you'll choose that one. But you can choose any challenge that actually matters to you, something you need to work on. Like your boss has said, we need to make progress on this. Or your Ministry of Health has said, this is a priority for the country or for your state or for your region or district or health facility, whatever it may be. So that is how you should focus your challenge. Let me check. There are some questions in the Q&A. All right, so let me see. Okay, there are questions about twinning. All right, so anyone from Afghanistan? My problem is how to use Android phone. Yeah. Okay, I see. Okay, thank you, Sani Jafar and others who've been answering questions. Let me see. So, all right, for Dr. Abul Samad Khan, whose video is not clear and readable, that is due to bandwidth. We'll share the recording. You'll see the recording is very clear. Amjad Hossein, any idea from Somalia? Yes, absolutely. I think it was in the list. Let me check, actually. So we have Tanzania, Sudan, South Sudan. Oh, okay, I stand corrected. No, there are actually 6 ideas from Somalia. We went through all of them. Can we use tables or maps? So this is from Aniket Rana. Can we use tables or maps as in cover notes in situation analysis, like finding of recent coverage, evaluation, survey data of district? Absolutely. So put in your situation analysis as much or as little as you can do within the 2 weeks. So do not overcommit. You can keep it simple. Make sure that it's useful to you and that you get it done. All right. Some people will begin to launch, extensive investigation and analysis for which they actually have no time. You have 2 weeks. So that's the first reality check. The second reality check is make sure it's something that it leaves you with something that you can actually use. And the third one is use as much data as you can. Not just your opinion about the situation, but actual data. That is, and then let me see the other question. So for Samuel Orwa, who says, may I know fellow Kenyans in the movement? Samuel, if you go to your learning dashboard, you will find the link to join the Kenya country team. There's a very active and dynamic country team now. Some of you, sorry, I'm not sure who just has a leftover hand, but I want to take 11 more minutes. We'll go until 30 minutes past. And I realized this is a lot to be starting up with this situation analysis. So I wanted to stay over a little bit longer. And for those of you who have the time to take you through what is involved in situation analysis, to make sure as many of you understand what we're offering, so you can make that decision. Yes, I will join the exercise, or no, I'm not interested, and then be equipped to participate. Okay, let me go. Let's see. Let's go to Nasiru Shuaibu. I see 2 hands raised. I know Nicholas has a hand raised, but has never answered, so I won't go to Nicholas. Nasiru Shuaibu, please go ahead. What is your comment or question about situation analysis?
Yeah. Thank you so much for the situation analysis, how we can be able to design our solution analysis to ensure how we can take a step to overcome our challenges. But actually, I can see even someone in the chat box is trying to understand how will he get the template for him to be able to use. But in my own issue, I have designed and I have gotten the situations based on the issue of what I have been seeing is our own challenge for the issue of this COVID-19 vaccination, where I work. Actually, most people are categorized into different categories. There are some category of people who they stay somewhere until when you meet them before they accept. And there are those whom they will come and look for that vaccine on you. And there are some who they will wait until when you were there to mobilize them. So I came to understand that the hesitancy is not all that much, but how can we reach that people so that they will accept and get this vaccine? So the support for us to be able to reach people in local areas to accept the vaccine, this is our problem. And then what can you advise us to do so that we can be able to reach these people so that we can move and meet them? We now immunize them because we all have the availability of the vaccine around us, but actually our situation is meeting them. The support that will be able to sponsor our teams to reach that hard-to-reach area so that they can give that vaccine. And then in regard with the template, probably if you can be able to share the template for those who need the template to see how they can be able to find out their own situations. Over, sir.
Yes, thank you, Nasiro. Two very good questions. So first of all, on the challenge, on your challenge, I encourage you to join François Gass and Charlotte Mbou tomorrow, because the experience sharing sessions are going to focus on specific cases of situation analysis. I'm pretty sure COVID-19 vaccination is going to be at the top as a challenge for many of you. And so that is where you will get to actually work on these situations. So on the second question, the template will be available through the learning dashboard. So I have shown this here. So you need, everything you do. So remember how to get started was here. So was everything about the ideas engine. So in order to participate in situation analysis, once again, you'll need to go to your learning dashboard. That is where you'll find the documents I've been sharing. And actually, there's an even more important step, which I have deliberately avoided mentioning because it is a sort of a technical step that you need to do, which is, let me see if there are others. All right. So let me go to here. So when you go to your dashboard, this is already available. The template and the rubric, the two key documents, the two key tools that you'll be using will be on tomorrow morning or probably sometime tonight. But right now, you have the instructions to join PeerGrade before starting your situation analysis. So what is PeerGrade? You've used Learning.Foundation. You've used the Ideas Engine, or most of you did. And now there is a third platform, which has a very specific purpose, which is you will use it to perform peer review. So you may be asking, why all these platforms, all these emails, all these passwords I can't keep up? Each one has a specific purpose. And believe me, if you can figure out how to use this one, next time your boss or in your work, somebody says, okay, there's a new DHIS2 platform, there's something else, you'll find that you are more capable than you were before. So one of our goals is to help you develop the digital capabilities. Increasingly, the work of immunization will take place through digital platforms. So consider this effort that we're asking you to make to join this platform, PeerGrade, an investment in developing your digital capabilities. So one thing is, we won't accept situation analyses sent by email. We'll always get a few people. Second thing is, PeerGrade is different from Learning.Foundation, so where you find the learning dashboard. And then you need to join PeerGrade now. It will not be possible to join after Friday. So do it now. It's kind of like with the Ideas Engine. The Ideas Engine, we gave you more leeway, but here you are going to be dependent on your colleagues. And this may seem a little frightening or even unfair, but let me tell you that even if you do everything right, if all the other participants, you will be dependent on 3 of your colleagues for peer review. If they do not honor the commitment that they've made to support you by giving you their peer review feedback, you will not be able to complete the exercise. So you are going to be dependent on them, and they are going to be dependent on you. That is what we use. This is how we use PeerGrade. So if you say, okay, yeah, I'll say yes to this situation analysis, but then you do not follow through, you will be preventing 3 other people from actually finishing this exercise. So please consider that. And this is what peer learning is about. Some of you are frustrated because you were not able to join your twin or your triplet. And that was an activity that we did for fun. All right. It was social. Even though it's about helping each other, it's still about the pleasure of just connecting with someone else. But this is a key lesson of peer learning, that you are dependent on each other. You are not dependent on the teacher. You are dependent on each other. And if you do not follow through with these instructions, you will be, instead of helping 3 of your colleagues, you will be preventing them from actually finishing the exercise. They will not be able to finish without you, and you will not be able to finish without them. Now for Adam Omar, the template or guideline will be available in your learning dashboard sometime between tonight and tomorrow morning. So let me just reassure you once again about that. Now to go back to the specific steps you need to join PeerGrade, there is a tutorial video here that explains how to join the full learning cycle 1 in PeerGrade, how you know if you've joined successfully, how do you log back into PeerGrade, and how do you submit your situation analysis. And so the first step, if you are not an alumni, If you are alumni, you don't need to create an account. So really this step is about creating your account in PeerGrade. So you click here to join the full learning cycle. I'm actually going to demonstrate how this works. And in my case, I have already logged in. But for the demonstration, I'm going to go back and log out and try again. So here I click from my learning dashboard, I click on the big red button that says click here. Now, I will, so I have two options. If I'm a new user, I create an account. If you are an alumna or an alumnus, you are an existing user, you'll need to use the credentials you used before. But most of you are new users. And so you'll go here, you'll type in your name. Whoops, let me see. Yeah, here. You'll type in your email. So I'm going to type in a different, here. And then you'll type in a password. So I'm not going to use a complicated password here. So this is really the nitty-gritty details, but I'm showing you this because if you cannot do this, you won't be able to do any of the good stuff. So what comes afterwards? So yes, Martin, there is a video on PeerGrade setup. What we found is many people do not bother watching the videos. It's just like people not reading the instruction manual. So I'm trying to reach those people. So Martin, if you've watched the video on PeerGrade setup, we really, really appreciate you. But we know that unfortunately, not everyone. There are some very good immunization people who do not read the instructions or watch the video. So maybe some are in the room, and this can help you if that is the case. Now we signed up, okay, and I see there's already a user with that name. So I'm just gonna So I will click here to create a new password. So here now I will put here my credentials, and I'm in the class, except here it says, got a code from your teacher, click the button to join. So if you see this, if you get asked for a code, where's the code? The code is here. It's the next line. So just read line by line, take your time to work through it. Do it when you're not under stress, all right? And take your time. Everything is in the instructions. We've never known of someone who follows the instructions and fails to complete the task. So here is the code. So I'm going to go to PeerGrade and join with code. It says type in your code. So we're going to, we're going to type in the code here. And here, now I'm in, all right? I'm in the full learning cycle, and I can see here, submit work, your situation analysis, initial version. And so I click on submit. What happens? This is only once you have your situation analysis. Let me be clear. You write it in a Word document. We'll be sharing the template in your learning dashboard between tonight and tomorrow morning. But once you've finished it in Word, do not send it to us by email. We won't receive any situation analysis by email. Go to the PeerGrade website. This is why you have until Friday to create your account. It won't be possible. You'll be locked out of the exercise if you don't do it by Friday. So please do not delay in going to your learning dashboard and reviewing these instructions. Once you're in, here, all right, you can see here you upload a file, and that is where that goes to your hard disk. And then you can actually find the Word document and submit it. And then the next step after that will be peer review, but we'll be showing you things one step at a time. So these instructions that I've just run through, including a great tutorial from Ja, my colleague at the foundation, that shows you really step-by-step how to do this, that is all in your learning dashboard. So if you have not reached your learning dashboard yet, I'm giving you the link once again. At the bottom of the page, there's a little link to recover your password. So that's it for today. I see several hands raised. Let me just check if I think I have answered all questions. Let me just give one more chance. If you have questions in the, please put them in the chat or in the Q&A, so we can get to them. I see we have many open questions. For Pervez Yousaf, who says where to get the rubric, that will be in your learning dashboard. It'll be added between tonight and tomorrow night. One consequence, you can see I've been a very bad student. I'm at 0%. Those of you who reached 0%, because we're going to be adding new articles to the dashboard, you will find that your percentage go down. Do not panic. All right. This is fine. Your percentage will go back up. It's simply that as you go through, you'll see there are new articles. So the percentage of those you have completed will decrease. And again, the same method. For those of you who were asking earlier, where are the recordings? Well, the recordings are right here in the live sessions here. The same with the sessions to share experience are here. The technical support sessions are here. So you can always catch up by going to your learning dashboard. That's really the key. All right, this has been a very, an extra long General Assembly, but we realized that, you know, it was important, we felt, to actually take the time to talk through some of these issues, help you get started, and then tomorrow will be the experience sharing. So what that is where we will be really, and we won't be setting you reminders by default. So if you do not register for this session, you will not receive the notifications. And we know the notifications are really, really important for you. So for some of you at least. Again, some people do just fine. They don't need reminders, but then other folks very much do and can be completely lost without them. So we try to accommodate everyone. If you're frustrated, if you're not happy with how things are going because there are too many emails or not enough, or you don't understand how it's going, remember, do not suffer in silence, and please be indulgent with us. We're doing the best we can. There are thousands of people working together in this movement. We want to bring as many people along as we can. Anyone who's willing to make the effort should be able to complete these activities. I think that is it for today. After 2 back-to-back sessions with the Francophones and the Anglophones, I'm exhausted. I thank Charlotte. And just sorry, Charlotte, you could not participate, but it's good to have you in the room with me. And I know, that you are 200% with me. So let me acknowledge a few of the people. There are many thanks and goodbyes. Really appreciate the commitment that everyone is making to improving immunization. Want to say hello to a few more people online. Ayuka Charles, Adam Omar, Dr. Moses from Liberia, Bakir Salis. Adam, I've answered your question. And then Dr. Zinbo at midnight. All right, let's give a round of applause to Dr. Zinbo and others in the Asia Pacific regions who are up in the middle of the night to participate in this live session. You can, of course, catch the recording on YouTube and other places, but we really appreciate the commitment, special commitment and dedication. Hope this has been a useful session for you. Take care. And remember, do not delay. Take a look at the, download the documents, watch the tutorials, join peer grade. You have until Friday to do so. And I hope you'll let us know that whether or not this is helpful to you. You'll see the survey pop up right after you you leave this session. Take the time to answer the questions. This really helps us. You can let us know if anything is wrong. Take care. Bye-bye.